Today, I wanted to spend a little bit of time on our live broadcast talking about what is pelvic physical therapy. Because I would say for about every 10 new patients that we get coming in to see us here at Legacy Physical Therapy, about 7 to 8 of them sit down and start to chat with the therapist here and tell us that they have never heard of pelvic physical therapy, and they're surprised that it's a thing, and they have no idea how we can help them out. So we spend a lot of time up front with some education on how pelvic physical therapy may be helpful. So I wanted to hop on today and kind of enlighten people a little bit more about what we do here at Legacy Physical Therapy. And we are passionate about helping women and men maintain and improve their core and pelvic health, improve bladder, bowel, and sexual function, all without the use of medications or need for surgery. So this is conservative treatment options for many conditions that people maybe aren't aware that they even can do anything about. So I want to jump right in and talk about some of the conditions that we see here commonly, and just to give people kind of a heads up with that. And really, we work a lot with women and men who are dealing with bladder issues. So that can be anything from bladder leakage to urgency, frequency, feeling like you got to go all the time, maybe even difficulty urinating. We also work with people who are dealing with bowel issues such as constipation or incontinence, and that can be leakage of gas or leakage of fecal material. We deal with people with lots of different pain issues, so abdominal pain, pelvic pain, hip pain, back pain, SI joint pain, pain in the vaginal or rectal area, pain in the penis, coccyx pain. So these are just a few of the conditions that we see a lot here. We also work with men and women who are dealing with pain with intercourse, or maybe people who are having pain with sitting in the pelvic area. So there can be a lot of variety. One of the areas that we're passionate about here is working with men to help them regain bladder control after prostate surgery. Another area that we love working with here is helping women during pregnancy to have a pain-free as possible pregnancy and to return to optimal core and pelvic health in the postpartum period. So we see a lot of women here after they've had their babies and help them improve their pelvic health and return core strength, work with something that's called a diastasis recti, which is their maybe a separation of the abdominal muscles. So we help them to, in a conservative way, be able to improve upon that. So those are just a few of the conditions, and as you see, that list was actually kind of long. So there's a wide variety of different issues that we see here. One of the things that I've commonly seen is that we get people who are maybe referred here by their urologists for bladder issues. And then once they get to talking with them, we find out that they also have some back pain or hip pain issues that despite treatment aren't going away. And we learned that they're all interrelated, that our pelvic floor muscles are part of our core support system. So they need to coordinate together well with other muscles around the area and work in that coordinated fashion in order for things to be going appropriately. And if they're not, some of those nagging injuries and aches and pains may be a result of a pelvic floor issue that's not being resolved. And that's where a pelvic physical therapist could come in and kind of partner with you and help out. One of the things that we get asked a lot of times is, I'm already doing Kegel exercises. That hasn't helped. Why would coming to pelvic physical therapy help? And for those of you who don't know, a Kegel exercise is simply a contraction of the pelvic floor muscles. Think about trying to hold back pee or hold in gas. Those are the pelvic floor muscles And those are what you're tightening when you are using those muscles. And think about that in the sense of if we have a dysfunction or a problem in the muscles, it's not simply about contracting them. Okay, that's where people go wrong. So if I had hand pain or a hand problem, that'd be like a healthcare provider saying, okay, you've got a hand pain issue. Just tighten your hand all the time, and that's going to make it feel better. That's really not going to do it. So we need to make sure that we have a variety of different movements with the muscles. Muscles need to be able to contract, relax, stretch, coordinate with other muscles. And as a pelvic physical therapist, it's my job to figure out if your pelvic muscles are doing that with all the other muscles around the area. So we really take a whole body approach to looking at how things are coordinating together. So it is never simply just about the Kegel exercise. That may be part of your treatment. It may not be. Some people are doing pelvic floor muscle contractions or Kegel exercises incorrectly, and that is actually causing more of a problem. And so we have to work on getting you doing them the right way. Or maybe your pelvic floor muscles are already too tense and tight, and trying to squeeze them more isn't going to improve what you've got going on. So we need to actually teach them to relax and let go. So we may be focusing more on down training or relaxing the muscles. So there's a lot involved in proper muscle function, and that's where partnering with a pelvic physical therapist can help you out that way. Another thing we hear commonly when we talk with patients on the phone is that I'm planning on having a surgery, so why would I need to see pelvic physical therapy? And my simple answer to that is, if you were planning on having shoulder surgery or neck surgery or back surgery, knee surgery, 9 times out of 10, you're going to work with a pelvic or with a physical therapist either before or after the surgery to help make sure that you rehabilitate the muscles and that everything is working well together. And that's where working with a pelvic physical therapist after you've had surgery for maybe a bladder sling or a prolapse repair or a hysterectomy or giving birth. I know most people don't think that falls in the surgery category, but if you have a C-section, then you're giving, that is a surgery to the abdominal area there. So any of those situations are times where muscle function has been disrupted, and we need to make sure that those muscles return to optimal function so that you get the most benefit that you can for the longest period of time with that surgery. Okay, so otherwise, I see a lot of people who have had some sort of pelvic repair maybe 5 or 10 years ago, and it helped for a while, but then it didn't, eventually their symptoms came back. And what I think is happening there is a lot of times people never learn to change their habits or their movements, and therefore they still have issues over time. And so working with a pelvic physical therapist can help you to kind of resolve those issues and make sure, like I said, that you heal optimally from the surgery and get the best outcomes possible. Another thing that we hear often from patients is my mom, aunt, sister, grandma, they all had bladder leakage or have bladder leakage, or they had prolapse, pelvic prolapse. Doesn't that mean that I'm just destined to have that and I should just live with it? So there is a genetic component to what we've got going on, but we can always improve upon the genetic card that we're dealt. So it doesn't mean that you are marching down the road to diapers or a pelvic repair surgery simply because your mom and grandma had that. It does mean that you are more at risk for it, and that there are things that you should be doing to try and prevent that from happening and make sure that everything is functioning optimally together. So that, again, is where pelvic physical therapy can help to make sure that you are doing what you need to be doing. As you may have already heard me say, I have mentioned men. A lot of times people think pelvic physical therapy is just for females, but we do work with male clients who are dealing with pelvic pain or bowel issues or bladder issues. So it's not just for females. And so men have pelvic floors too. They function fairly similarly to female pelvic floor, but we just need to make sure that they are working optimally to prevent that bladder leakage or to improve upon pelvic pain. So it's not a case where it's simply something that only females can experience. Men can experience pelvic floor dysfunction as well. So a lot of times people have thought that they don't need to see us unless they've had a baby. That it's only for people who have had children. Now, females who have had children are definitely more at risk for pelvic issues, whether it's a C-section or a vaginal issue. So here at Legacy Physical Therapy, we feel strongly that every woman should see a pelvic physical therapist at least for one visit postpartum to identify any musculoskeletal issues that may be preventing her from improving her core and pelvic function postpartum. This should happen before she starts out with any type of exercise regimen, especially a high level one, to make sure that her pelvic floor and abdominal muscles are functioning the way that they should be, so that she doesn't develop any bad habits that potentially leads to problems down the road, such as bladder leakage or pelvic prolapse. We also love working with pregnant women during their pregnancy to help make sure that they are feeling as comfortable as they can be, and also not doing things that can cause any extra stress and strain to the abdominals and the pelvic floor, because pregnancy in and of itself is a time frame that is can be very stressful on the abdominals and pelvic floor because of the changes in your body. And so working with a pelvic physical therapist to help you maximize pelvic and abdominal support and control can really make a big difference for a comfortable pregnancy. So one of the things that I hear all the time here is, why didn't my doctor tell me about pelvic physical therapy? So a lot of our patients come to us via their friend told them about us, or they found us on the internet, or saw us in some type of a patient chat group, something like that, and they have seen many doctors potentially for their pelvic pain issues and have never been told that pelvic physical therapy is an option. Unfortunately, a lot of doctors are unaware that it is an option out there, that it is a conservative treatment option for women, and even the ones who do refer to pelvic physical therapy oftentimes don't necessarily know all of the different things that we can be doing to help patients out. So you may have to be an advocate for yourself if you feel like you need to see a pelvic physical therapist. So don't be afraid to ask your doctor for a referral to pelvic physical therapy if you feel like you're dealing with any of these issues that we've been talking about. You may have to be the one to advocate for it, and you as the consumer have the right to go wherever you want to go for your treatment. You do not have to necessarily go only to a place that is in your doctor's office or in your doctor's building, and that you can seek out care from a pelvic physical therapist that you feel comfortable with.